think that cholesterol, we can watch for that. Weight gain issues its own challenges, but once we're sort of monitoring that area, I think the big toxicity and sort of the main reason why 100% of people don't receive lorlatinib are the neurocognitive effects. This drug is very effective in the brain. Part of the reason it works so well and works for so long, but also part of the reason it has very unique toxicities, these neurocognitive side effects. Laura, can you talk a little bit about sort of what those might be, how they can manifest?
Sure. Yeah, they can manifest in a few different ways. Depression, personality changes. So for that reason, it's really important that you have the family or caregivers or friends involved, because these can be subtle changes that we may not see on spending just a few minutes with patients at their visits. You might not capture some of these changes and the extent of these changes, and the patient themselves may not even realize that their personality has changed or they're behaving differently. So it's really important to get outside involvement to understand what's going on with the patient.
Mary, any experience there, or how do you discuss that with the patient?
I think once you, like you do everything else, being honest, I think, Dr. Liu, it's just taking it back to it's something you have, as Laura said earlier, these conversations, you repeat them in probably using different words, different language, but you check in with them that, is there any concerns regarding how they've been managing, and just asking them, how have you been, how do you feel, and if there are no changes in irritability,
yes.
Any, if they've got young children, how they're coping with the young children, if they're working, how they're managing work, and often depending on what they are, if you ask the question, you'll pick up on something and say, is that new? And then have a further conversation about it. And I think an important part of that conversation then is just taking it, saying, as you know, we need to make sure, that this impacts on every aspect of your life, including your family relationships, your community, your professional roles, and then going at their pace. And if, as Lara said, I think it's really important, just saying if your husband Tom was here, would he have any concerns, or does he notice anything different? Yeah. How did you manage? You said Christmas wasn't great. What was that all about? Or school holidays weren't great. What was that all about? Mm-hmm. And just, peeling it off slowly and thinly, and making sure you get it fully peeled off, and actually then explaining to the patient why you're actually sticking with this point of conversation. It's not necessarily purely a social conversation. There's a professional focus to it and a duty of care to them.
Yes, I think that's really important. And these can be subtle changes, to your point, Laura, and I think that we do want to have patients and their families on the lookout for it, explaining it, because a really important point is that it responds to dose reduction. It can get better. It means we might just be giving a little bit too much. Yeah. So if we drop the dose, we can resolve it. The real challenge is identifying it as the time with the patient continues to decrease in the healthcare models. We don't want it to go unrecognized. And I think that we often hear, and I think we've all seen various examples, personality changes can be subtle. It can be someone that is more irritable, that is maybe a little bit meaner, and that can really damage relationships with children. It can lead to marital problems, divorce. It can lead to major impacts. I'll say you probably don't hear as much about people being happier because it's not viewed as a complaint, but I would argue it's just as important. You don't want to change who somebody is. Yeah. So really any change just means we might be giving too much. Shirish, what's your experience, what's your advice for this?
Yeah, I think when I do discuss this side effect, I do try to emphasize that at least I have not seen it permanent. That is, if you identify the toxicity and the initial response is hold the drug. In fact, I tell patients that if you start noticing something, or your spouse or your partner starts noticing something, it's okay to not take the drug.
Yes.
Contact us, we'll assess you. You're not harming your care in any way by even holding it for a few days. Yeah. So, but what is important to note is that once you hold the drug, generally these side effects resolve quite quickly, and there is not a permanence of this effect. I also feel I like to see these patients a little more frequently. I mean, there is sometimes a tendency on targeted drugs that you may see them once and then, get them on a every 3-month schedule. But with lorlatinib patients, I may see them a little more frequently in the first few months because these toxicities tend to emerge within the first few months of starting the drug. And I think it's sometimes for you as a provider to assess them and identify these toxicities, fully understand sometimes patients we may not be able to perceive it, but it's the partner or whoever they live with who identify it. But I do think that seeing them a little more frequently, we may identify certain things that may not be apparent just on a visit or seeing the patients every 3 months. So lack of permanence of these side effects, generally holding the drug, and then with dose reduction, in many patients, you don't see a recurrence of these side effects.